Friends, 8th June is observed world over as World Brain Tumour Awareness Day, and it is very important to know about this day because on this particular day we try to educate people about early symptoms of brain tumor, what are the new advances in brain tumor treatment, and how to self-diagnose early so that cure is possible. The purpose behind observing any health day is to create public awareness, to give positivity to this subject in public mind and assure the public at large that these problems can be overcome with modern science. So, how did this day start? It was in the year 2000 that the German Brain Tumour Society proposed that 8th June should be observed as Brain Tumour Day, and then world over it picked up, and now for last many years 8th June is observed as the World Brain Tumour Day. Most important thing that we have to understand on this day, what is that? It is to know about the early symptoms of brain tumor. Understand about them, but don't be afraid, because if you know these symptoms, you will be able to diagnose your near and dear ones early and increase the possibility of getting permanently cured. The first symptom that almost everyone knows about is headache. Headache is so common that everyone gets it sometime or the other in his or her life. So, what is a headache that is associated with brain tumor? Unfortunately, there is no specific type of headache that always points towards the brain tumor. But there are certain indicators. If you go by the textbook definition of brain tumor related headache, it happens the most in the early morning. It wakes you up from sleep. When one gets up with headache, there is projectile and spontaneous vomiting. And this is not preceded by nausea or trouble in your stomach. It just happens so spontaneously and catches you off guard that suddenly you throw up, and because it is sudden, it is projectile. So this is a very typical feature of brain tumor related headache, waking the patient at night or early in the morning followed by vomiting, the headache getting worse when the person is bending down or lying flat for a long time. The headache can increase. But this typical type of headache is seen only in 10 to 15% of the brain tumor patients that we see in our center. The more common headache that we see associated with brain tumor is a very, very common type of headache. But you have to remember, if somebody starts getting headache first time after the age of 35 or 40, that is somebody who is not a known migraine patient starts suddenly getting headache, one has to take notice. If the headache goes on increasing in intensity over the period of time, one has to take notice. If headache is associated with visual problems, that problem in vision, one has to take notice. If the headache is associated with vomiting or reduction in power in some part of the body or paralysis along with the headache, one has to take notice. So these are a few pointers. There is a specific type of headache sometimes occurring with brain tumors called as the posterior fossa tumors. It is very sudden thunderclap headache when posterior fossa tumors suddenly obstruct flow of the brain water of CSF and cause acute hydrocephalus, or if the tumors bleed suddenly. This headache is called as thunderclap headache. That means it comes from nowhere, it is very severe, and it has to be taken seriously. When I say taken seriously, it means one has to take notice and get investigated. It doesn't mean that it is always going to get diagnosed as brain tumor. But you should not neglect these headaches. Next symptom associated with brain tumor is fit or seizure. And this fit can be sudden movements like this, or it can be subtle movement on one side of the body, something like this, or in the leg, it is called as focal seizure. This seizure is called a generalized seizure, and the patient loses consciousness during this seizure. The loss of consciousness is usually transient. It remains for some time and the patient wakes up. When the patient wakes up, at times he is confused or there is loss of power on one side of the body from where the seizure has started. It is technically called as the Todd's Paresis. And this type of seizure could point towards brain tumor. But again, seizure disorder is very common in the society. Nearly 1% of the population is affected by seizure disorder. So it doesn't mean that every seizure heralds brain tumor diagnosis. But definitely it has to be taken seriously, investigated, scanned. The third symptom associated with brain tumor is nausea and vomiting. And this vomiting, as I discussed with headache, is usually sudden, projectile, and not preceded by nausea. So vomiting is one of the symptoms of brain tumor. The next symptom is visual obscuration. Patients complain that they feel that their vision is not normal, and sometimes they cannot really qualify what they are saying. Not normal means what? They cannot really describe, but it becomes blurred. Part of the visual field gets cut off. So this symptom of visual loss is usually progressive. It goes on increasing. At times, patients can complain of double vision, and that can also be a symptom of brain tumor. The next symptom that is associated with brain tumor is change in behavior or psychiatric symptoms or personality changes. And this happens very gradually, especially in the tumors which are located in the frontal area of brain or which are located deep inside. And especially with the slowly growing tumors like benign tumors, for example meningiomas, this change is very subtle and very progressive. So it is sometimes not noticed by the near and dear ones, but it definitely occurs over the period of time. This can take a form of progressive dementia-like state. Some people, along with dementia-like state, also say that they get confusion and they find it difficult to balance themselves while they are walking. That is, loss of balance while walking associated with confusion and dementia-like symptoms can be a complex of symptoms associated with the brain tumor. Again, a caveat here. All these symptoms that I have discussed till now, they are very common in other disorders. So when they occur together, then only they have to be taken seriously. The next symptom that can occur with brain tumors is progressive loss of power of one side of the body. For example, if the tumor is pressing on the area of power on the right side of the body, then left side of the body slowly gets weak or paralyzed. Similarly, if the tumor is pressing on a specific cranial nerve, then there can be paralysis of the face, progressive slow paralysis of the face, or loss of hearing can be a symptom of brain tumor, especially in tumors called as the CP angle schwannomas or CP angle tumors in general. So very rare symptoms that we see with brain tumors is sudden loss of consciousness. Usually there are other symptoms preceding this, but rarely in a tumor which for some reason has not produced symptoms for a long time can suddenly obstruct a part of the water pathway inside the brain, and it can suddenly cause obstruction of the water system or CSF, which builds up very rapidly and there is rapid loss of consciousness. Another instance in which this can happen is when the brain tumor bleeds suddenly and the patient loses consciousness. This can happen rarely, but we need to remember this. And unfortunately, knowing this symptom, we are not able to prevent this or diagnose the tumor early because it happens very, very suddenly. A very rare triad which can evolve with tumors is very similar to what we call as normal pressure hydrocephalus. Only difference is that here it is happening in relation to a tumor. It happens because the tumor presses on the long tracts, the person gets dementia. He or she tells us that they are losing control on their urine. They cannot control the flow of their urine. When they get urged to pass urine, they cannot really wait till they reach the toilet. There is urgency, and along with that, the relatives tell us that the patients are losing the ability to remember things, especially the recent things. So there is early dementia-like symptom, and these patients are not able to walk with confidence. They start to lose their balance very easily. They don't know how to walk, so it is called as gait apraxia, and this happens in tumors which press on the central portion or the long tracts or long motor tracts of the brain. And so these are few of the symptoms with which the brain tumors can present. There are specific tumors like pituitary tumors which also come under brain tumors, and there you will get hormonal symptoms, either a lack of hormone or excess of hormone. It is a different subject, and I will cover it under the symptoms and signs of the pituitary tumors and how to diagnose them early. So for today, this is all I want to discuss on the occasion of World Brain Tumor Day. If you want any more information about brain tumors or our brain tumor center or our work on the brain tumors, our experience of surgeries and cure of the brain tumor, our research on the brain tumors, I have given the link in description. You can go through it. We have a lot of public education pages on our website and on our YouTube channel. Do visit them, do get educated and spread this education, especially on this day, which is the 8th of June, World Brain Tumor Day. Thank you.